Hello guys, and welcome back to another video. Today we're joined by myself, Bilal. I'm a dental graduate, and Zinneerah, who is a final year dental student. And we are going to be doing a live mock panel interview. And this is just to give you a simulation of what a panel interview feels like. The example answers are going to be as ideal as we can possibly give them. And fun fact, and I promise I'm not just saying this for interviews, I don't know what the questions are. So she's going to ask me the questions off the bat and I'm going to give a response. So you might see some stumbling, you might see some mistakes, but this is a real raw example of footage of what a good interview looks like. I'm someone who got 4 dental offers from dental school and ranked 7th out of 292 interviewees at one of my interviews. So I've got the experience from my days, and then I've been coaching people for the last 5 years into dental school. So this is what I can produce, and if you can get to this sort of level, I'm sure you're going to be fine with your interviews. Okay, let's get into it. Okay,
so what is your motivation to study dentistry?
Thank you for having me. So my motivation for joining dentistry, I take that as what reasons have led me to go into a career in dentistry. And the first thing I want to do is give you a bit of insight into the research that I've done. So initially, I didn't know I wanted to do dentistry. I explored pharmacy, medicine, optometry, and I did work experience in all 3 of those domains. I then also did dental work experience. And what I found is that the skills of a dentist and the lifestyle within it is what appealed to me the most. And if I could boil it down to those reasons, it's probably 2 things. Number 1 is the blend of science and artistry. And the second thing is the fact that you get to go on this journey with patients, regularly see them, and every single time improve their health in some way. So in terms of the science and artistry, I remember being on my work experience, and there was a dentist that was doing an occlusal filling under rubber dam. And this filling was opened up and there was a lot of decay. The patient was in a tiny bit of pain from it here and there. And the dentist took a tooth that was decayed, they opened it up, and then the level of chemistry that was involved in repairing it was interesting. The way that they had to use certain materials to get the white filling to stick to the tooth. And then the way that they used, I think it was called etch, to create some pores in the tooth. And then all of that, they then layered the filling in increments and made it look exactly what it looked like before, but a lot more neater and cleaner. And then I realized that afterwards, the dentist told me they have to use this blue sheet called rubber dam to stop moisture from getting into the tooth. So I realized there's so much chemistry in this, but by combining that chemistry with your hands-on skills and your artistry, you can make things go from a really broken down state to a really nice state. And then the dentist showed the patient a before and after picture and they really liked it. So having that regular chance to make an impact on someone and make them feel better about their teeth is cool. And then in terms of the continuity of care, I noticed that in loads of consultations where dentists did new patient exams, there was a portion of that treatment where they'd ask the patients about smoking history. And they would dive into the effects of smoking, how it causes gum disease, what patients can do if they want to slowly wean off smoking. And just that one interaction that you can have every single day and every 3 months with patients can genuinely help them to start forming better habits. And it's not just with smoking, it's with your diet, it's with the way you brush. So I guess that fact that you get to meet people properly and instill better habits in them and teach them something really appealed to me too. So it was those 2 things that I really resonated with, and that's why I took it further.
Okay, nice. Thank you for answering the question. What is the importance of communication in a team?
Good question. So I think communication is really important, and the 6th standard for the dental team is communicate with your colleagues in a way that's in patients' best interests. Now, if I think back to my work experience, the 2 interactions that was so important in any clinic I was in was, number 1, the communication between dentist and receptionist. Imagine you are running late with a patient, or your schedule has had loads of cancellations. Who do you go to seek advice or to tell a patient that they might need to come in a bit later? It's your receptionist. And if there's no line of communication there, it will detriment the way that patients are treated. You know, you could have a case where you've ran over 30 minutes, no one's told the patient, and they now need to leave and they can only give you 5 or 10 more minutes. And that's going to make them feel upset because they've wasted time. On the other hand, you know, you need someone to help you plan your weeks out, and the receptionist is handy for that. In clinic, I think your nurse is so important. They will set up the bay and clean it down in between patients. They will take your notes for you. They can do charting for you. They can just make the process of treating a patient a lot easier. I remember there was a case where a patient needed a tooth extraction, and it was really difficult because it was one of the back teeth at the top and it was hard to visualize. And you could tell the dentist was really trying to struggle to get that tooth out, and they had to concentrate. But then at the same time, the patient was anxious, and anytime there was a crunching sound or a sound of a feeling of some pressure, they would get scared. The dentist struggled to do the filling and also manage the anxiety, and that's where the nurse came in and really comforted the patient and told them everything that's happening. That was another example of teamwork. So I think you need to communicate with your team so that you can prepare for challenges that might happen in patient cases, and also communicate delays that might happen in your schedule to make things run smoother. And it's all for patients at the end of the day.
Yeah. What do you think are the 3 most important qualities in a team?
The 3 most important qualities in a team, that's a good question. Let me have a think. The first one is listening. I think the ability to take on board feedback from other members of the team. Think about a newly graduated dentist. You're going to be working with a nurse that's had years more experience than you. You might be doing something in your approach towards patients or the way you run the clinic, and the nurse can see that you might be making a slight mistake. You should be open to listening and getting feedback, because your team members are genuinely there to look out for you, and they can stop you from getting into mishaps in the future. The second thing I think is dropping the ego and remembering that everyone has a core part to play in patient care. So whether it's a receptionist or a nurse or a dental hygienist, you all occupy a different role, and if any of those members of the team was removed, the whole practice would collapse and patient care wouldn't be able to be carried out. So I think you need to respect everyone and give them the care and attention that they deserve, and try and breed a positive environment. So positively reassure your nurse, your receptionist, and let them know how much they do for you, because at the end of the day, as a dentist, you're nothing without them. And I think the third one is probably honesty and openness, and not feeling any fear to give feedback to people, and taking feedback on yourself, because that sort of culture is what allows you to cultivate growth. And if there's an environment where if you are doing something suboptimally, someone can give you advice and you're happy to take it without any egos involved, I think everything runs better.
Yeah. What do you think empathy is used for in dentistry?
So empathy is that ability to listen to a person, understand their problem, and then come up with a solution or some advice on how to help them. So a key thing that I saw in my work experience was this whole idea of treatment planning. And I noticed that often patients would be given 2 or 3 options to deal with a damaged tooth. There was one case where a patient had severe decay and they could have had the tooth out, they could have had it extracted, and they could have done nothing. And I remember the dentist was telling them all the risks involved with each procedure, the benefits of each one, and the patient left quite overwhelmed. And I had to think about that, and I thought to myself, well, you need to be able to communicate stuff in a way people can understand, and then give them time to make options on what they want to do. So empathy is also about tailoring your communication, whether that's in the way you explain something, or whether that's a child that's come in and is anxious. You might deal with anxiety in an adult by talking them through what you're going to do, and using some other forms of desensitization. But with a kid or a child, it might be easier to do something like the tell, show, do technique. Tell them what you're going to do, show them, let them have a go themselves with the instruments you're going to use, and let them build that sense of familiarity. So tailoring communication is a big part of empathy, and the purpose of the skill is to just connect with people and let them feel comfortable with you.
Yeah. To follow up, so do you think empathy can be taught? I
think there is some element of theory behind empathy and understanding how it can be employed. For example, you could show students consultations where there's an empathetic approach and a non-empathetic approach, and that lets you compare the difference between what it is and what it isn't. But ultimately, I think in terms of practicing the skill, you have to get hands-on, and you have to actually deal with situations where patients require empathy. So dealing with the anxious patient, the nervous patient, dealing with someone who doesn't understand something, dealing with someone who wants to make a complaint about you. The more scenarios you're exposed to where patients are upset or frustrated gives you a chance to build that empathy and put it into practice. But otherwise, if you just learn the theory and you never get to put it into place, you might not build it as well.
Yeah. So that's everything for today, Bilal. Thank you for joining us.
Thank you for your time.
So let's analyse Bilal's answers. Okay, so first of all, with the first question of why does he want to study dentistry? He answered this really nicely with good structure. There was a good opening, good middle, and a good ending. He opened it up by explaining that there were 3 main reasons why he wants to study dentistry, and then went into each of these 3 reasons and explained them really well and really thoroughly, and then finished that off really nicely as well. And as for the second question, for the importance of communication within a team, he answered it really well in terms of he went through what the importance of communication is in a team, but also how it applies to dentistry. He talked about his work experience, went into how the dentist and the dental nurse use communication on a daily basis. Not only that, but also how important it is for the dentist and the receptionist to use good communication as well. So that was really good to see a good application. The next question, which was the 3 most important qualities in a good team. It was good to see that at the beginning of the question, he just jumped straight into the answer. He took some time to think about the question, think about what the 3 most important qualities are, just because there are so many good qualities that you can have within a team. However, he took that time to kind of think about it and let the interviewer know that he's thinking, and then went into 3 good qualities and explained them really well. For the last question, which was the importance of empathy, he answered that really well as well. It was good to see. That he explained the definition of empathy, went into the meaning of what it is to be an empath, and then also went into the application of being an empath in dentistry. It was good to see that he quoted work experience scenarios. So that's it, guys. Thank you for watching. That's a mock panel interview. We'll see you in the next one.